We're going in depth this Friday on a procedure to help heal muscle injuries. It's called platelet-rich plasma therapy, and it's become very popular, especially in the world of professional sports. Dr. Randy Shuck has more details.
Joining me now is Dr. Michael Markou. Dr. Markou has an interesting procedure for us to talk about today. Not really a new thing, but something that's becoming a little bit more popular. It's called platelet-rich plasma, or PRP. So let's go into the idea or the theories behind this first so that our viewers can understand what we're talking about.
Well, we start by explaining how the body heals. When you have an injury, whether it's a cut or a broken bone, platelets rush to that area of injury. And when they get to that area, they activate and they basically release growth factors. And the growth factors do their job with starting to heal. So what we're doing is we're basically concentrating these platelets and we're putting them where they're needed. For example, if a patient comes in with a shoulder injury or a knee injury, we inject it into that area that's of concern.
All right, so we look at this, this is a natural thing. Our
Yes.
bodies carry it anyway.
Yes.
And so tell us a little bit how you gather these things. I'm sure you're in there just pulling these things out randomly, or it's pretty straightforward.
It's pretty straightforward, actually. It's a blood draw. We draw the patient's blood as if you're getting your cholesterol drawn, but we use special centrifuges. So we place it in a centrifuge that will concentrate the platelets and separate the platelets during the spin.
And then after that, you take that nap off, and then do you do anything special to it?
We do not do anything special to it. We don't add anything to it. We simply inject into the joint. We numb the joint first with a little bit of lidocaine, and then we inject the cells. And it's very minimal pain, painless, basically.
All right, so when we heard about this in the past, the FDA was a little excited about this. A lot of the professional athletes were using it, but they're not using this plain procedure. They were doing what you called activated, right? So tell us a little bit difference between those.
Yes, if we collect the blood from the patient, we spin it down, we concentrate the platelets, we re-inject them, we're not changing the platelets in any way. Now, you could also activate these platelets outside of the body by adding thrombin or calcium, and this is changing the compound. And the FDA would consider this a type of a medication, if you will. So you're not allowed to really add anything to it or change it. You have to draw it in the same facility and inject it back into that same patient the same day.
All right, and so this makes it so there's no great restrictions. So if I were a professional athlete and you drew mine underneath this technique, then I wouldn't be banned or have any problems with that.
Now, I can't speak for all of their guidelines, but it's not changed. This is natural. This is not growth hormone. This is not steroids. This is your body's platelets that are just concentrated and re-injected where needed.
All right, so let's now go into the thought patterns of where you use it and how successful it is. So you do this a lot. We were talking earlier, you're doing a lot of, so no great data out there for the big pieces, but we're seeing more anecdotal issues. So tell us a little bit about the people you're shooting in and how the results are.
Well, I shoot it into to athletes and even to our weekend warriors. Basically, I use it in shoulder injuries, back injuries, knee injuries, Achilles injuries. You could basically use it in almost any injury safely. And the response we expect is at least a 60 to 70% relief in the patient's symptoms. And we usually achieve that, if not more.
Wow. Now, I was talking to one of our staff members earlier, and he says, is it used for everything, chronic conditions, arthritis, and everything else? Is there one area that works better than others?
Well, yes, it is used in acute and chronic conditions. And is there one area it works better than others? Well, I use it mostly in low back, knee, shoulder. I can't say that there is an area that I could say it would work better in rather than, in any certain area.
All right, and how about the quantities? You were talking about this much, series, 1 time, 10 times. What do you think?
That's a good question. And if you read about PRP, if you Google it, you see a lot of physicians doing series of injections, offering 3 or 5 injections. I do 1 injection, and I follow the patient for about 6 to 12 weeks. Usually within that 6 to 12 weeks, the patient has a good 70% relief, if not more, depending on the injury and the severity of the injury. Also depending on the patient. If it's a patient with arthritis, an elderly patient, or a weekend warrior who gets injured, they'll do the 1 injection. They're happy with that 70% relief, and slowly that joint will continue to heal itself. However, if you're talking about a professional athlete or even a high school athlete, well, maybe they want to be more aggressive. Maybe after 6 to 12 weeks, they want to do one more to see if they could accelerate the healing even better.
Is there ever too much? Can I get too much of it at one time?
At one time, well, we inject a certain amount, and that's up to the doctor to feel the proper amount that goes into the joint, depending on the size of the joint. You don't want to inject too much. It just takes a little bit.
All right. And now on some of these it says actually the patients will feel a little worse first and then this comes on over time. Give us an average time frame that we should see some improvement.
I'll tell you, if I inject a patient today, basically the first 24, 48 hours, they might feel a little worse than before because we've injected volume into that joint and it could cause some pain. Basically the first 6 weeks is like a roller coaster ride. Some good days, some bad days, good days, bad days. The bad days are not usually any worse than their former bad days. Between 6 weeks and 12 weeks is when the patient usually gets their maximum response or their ideal response, and that's where we're talking about the 60-70% improvement. I'm sorry.
Sure. Yeah. Now, and one last question, because I know does it last a long time, or is it kind of wear off as time goes on?
Well, that's a good question, and I don't know for sure the correct answer. However, I don't believe it wears off. I believe that the particular joint continues to be utilized, and we continue to wear our joints. So yes, you might need another injection in a couple of years, but basically this is the body we're using the body cells that the body uses to heal itself, and we're helping the body to heal a certain area. So if we're causing any degree of healing, this should not just naturally reverse it, but it may re-injure.
All right, very good. Great information. It's not new, but it's new to us, and it sounds like it could be used almost anywhere for almost any person. So thanks so much for giving us the info.
Thank you.
Now, critics of platelet-rich plasma therapy say the cost really isn't worth the uncertain benefits. Still, many professional athletes have undergone that procedure and swear by it, including Tiger Woods and former Pittsburgh Steelers wide receiver Hines Ward.